Hello, everyone. Welcome to Bipolar Disorder webinar brought to you by Lam Foundation. We shall be exploring both Western and TCM concepts. Bipolar disorder in Western medicine. Bipolar disorder, also known as manic-depressive illness, is a serious medical illness that causes shifts in a person's mood, energy, and ability to function. 1% of the population aged 18 and older in any given year have bipolar disorder. Bipolar disorder typically develops in late adolescence or early adulthood. Bipolar disorder causes dramatic mood swings from overly high and or irritable to sad and hopeless and then back again, often with periods of normal mood in between. Severe changes in energy and behavior go along with these changes in mood. The periods of highs and lows are called episodes of mania and depression, respectively. Previously called manic depression, this disease is now called bipolar disorder. Now let's talk about the mania or manic episode, signs and symptoms. Elevated and expansive mood, also paranoid or irritable. Increased energy, activity, and restlessness. Excessively high euphoric mood. Extreme irritability. Racing thoughts and talking very fast, jumping from one idea to another. Distractibility, inability to concentrate. Little sleep needed. Rapid, excitable, and intrusive speech. Fast thinking, moving quickly from topic to topic. Unrealistic beliefs in one's abilities and powers. Grandiosity. Chaotic patterns of personal and professional relationships. Impulsive involvement in questionable endeavors. Reckless driving, excessive risk-taking, certainty of conviction about the correctness and importance of their ideas, poor judgment, spending sprees, a lasting period of behavior that is different from usual. Now let's talk about the mania or manic episode signs and symptoms. Intense and impulsive romantic or sexual liaisons, increased sexual drive, abuse of drugs like cocaine, alcohol, sleeping medications, provocative, intrusive, or aggressive behavior, denial that anything is wrong. In its extreme forms, there can be violent agitation, bizarre behavior, delusional thinking, visual and auditory hallucinations. Manic episode is defined or diagnosed as elevated mood that occurs with three or more of the other symptoms most of the day, nearly every day for 1 week or longer. If the mood is irritable, 4 additional symptoms must be present. Now let's go to the signs and symptoms of depression or depressive episode. Apathy, lethargy, lasting, sad, anxious, or empty mood, slowed physical movement, feelings of hopelessness or pessimism, feelings of guilt, worthlessness, or helplessness, loss of interest or pleasure in activities once enjoyed, including sex, decreased energy, a feeling of fatigue or of being slowed down, difficulty concentrating, remembering, making decisions, restlessness or irritability, sleeping too much or insomnia, change in appetite and or unintended weight loss or gain, chronic pain or other persistent bodily symptoms that are not caused by physical illness or injury, thoughts of death or suicide attempts. A depressive episode is diagnosed if 5 or more of these symptoms last most of the day, nearly every day for a period of 2 weeks or longer. Hypomania is a mild to moderate level of mania. Hypomania may feel good to the person who experiences it, and it may even be associated with good functioning and enhanced productivity. Thus, even when family and friends learn to recognize the mood swings as possible bipolar disorder, the person may deny that anything is wrong. Without proper treatment, however, hypomania can become severe mania in some people or can switch into depression. Occasionally, severe episodes of mania or depression include symptoms of psychosis or psychotic symptoms. Common Psychotic symptoms are hallucinations, or auditory or visual, and delusions. Psychotic symptoms in bipolar disorder tend to reflect the extreme mood state at the time. For example, delusions of grandeur, such as believing one is Jesus Christ or has special powers or wealth, may occur during mania. Delusions of guilt or worthlessness, such as believing that one is ruined and penniless or has committed some terrible crime, may appear during depression. People with bipolar disorder who have the symptoms are sometimes incorrectly diagnosed as having schizophrenia. Redfield Jamieson lists 6 criteria for the diagnosis of a manic episode as follows. A. Distinct period of abnormally and persistently elevated, expansive, or irritable mood. B. At least 3 of the following symptoms: inflated self-esteem or grandiosity, decreased need for sleep, more talkative than usual, flight of ideas, thoughts raising, distractibility, increase in goal-directed activity, social work, school, sexual, psychomotor agitation, excessive involvement in pleasurable activities, buying spree, sexual indiscretions, foolish business investments. C, mood disturbance, which is severe. D, no delusions or hallucinations. E, not superimposed on schizophrenia, delusional disorder, psychotic disorder. And F, no organic factor. A plus B plus C constitutes a manic syndrome, while A plus B constitutes hypomania. It may be helpful to think of the various mood states in bipolar disorder as a spectrum or continuous range. In the depressive phase, at one end is severe depression, below which is moderate depression, and then mild low mood, which is termed dysthymia when it is chronic. In the manic phase, there is normal or balanced mood, above which comes hypomania, mild to moderate mania, and then severe mania. In some people, however, symptoms of mania and depression may occur together in what is called a mixed bipolar state. Symptoms of a mixed state often include agitation, trouble sleeping, significant change in appetite, psychosis, and suicidal thinking. A person may have a very sad, hopeless mood, while at the same time feeling extremely energized. Cyclothymia is a milder form of manic depression with the swings between depression and hypomania. Cyclothymic temperament can be manifested in different ways, that is, as predominantly depressive, manic, hypomanic, or irritable. There are swings between cheerfulness and unhappiness. Not all individuals who have cyclothymia go on to develop the full manic depressive syndrome, but many do. 1 out of 3 persons with cyclothymia goes on to develop full-blown manic depression. Redfield Jamieson lists 5 criteria for the diagnosis of cyclothymia as follows: numerous hypomanic episodes for 2 years and numerous periods of depressed mood that did not meet the criteria for a major depressive episode. Never without hypomanic or depressive symptoms for 2 years for more than 2 months at a time. No major depressive episode or manic episode, not superimposed on psychotic disorder, and no organic factor. A diagnosis of bipolar disorder is made on the basis of symptoms, course of illness, and, when available, family history. The diagnostic criteria for bipolar disorder are described in the Diagnostic and Statistical Manual for Mental Disorders, 5th edition, or the DSM-5. Descriptions offered by people with bipolar disorder will give us valuable insights into the various mood states associated with the illness. A patient with depression. I doubt completely my ability to do anything well. It seems as though my mind has slowed down and burned out to the point of being virtually useless. I am haunted with the desperate hopelessness of it all. Others say it's only temporary, it will pass, you will get over it. But of course, I haven't any idea of how I feel, although they are certain they do. If I can't feel move, think, or care, then what on earth is the point? Then we listen to someone who has hypomania. At first, when I'm high, it's tremendous. Ideas are fast, like shooting stars you follow until brighter ones appear. All shyness disappears, the right words and gestures are suddenly there. Uninteresting people, things become intensely interesting. Sensuality is pervasive, the desire to seduce and can be seduced is irresistible. Your marrow is infused with unbelievable feelings of ease, power, well being, omnipotence, euphoria. You can do anything, but somewhere this changes. Then we have someone who has mania. The fast ideas become too fast and there are far too many. Overwhelming confusion replaces clarity. You stop keeping up with it, memory goes. Infectious humor ceases to amuse. Your friends become frightened. Everything is now against the grain. You are irritable, angry, frightened, uncontrollable, and trapped. We listen to somebody who has a manic attack, and this is a description of a manic attack given by Redfield Jamieson. At first, everything seemed so easy. I raced about like a crazed weasel, bubbling with plans and enthusiasm, immersed in sports, staying up all night, night after night, out with friends, reading everything that wasn't nailed down, filling manuscript books with poems and fragments of plays, and making expansive, completely unrealistic plans for my future. The following is a description of a depressive phase. Then the bottom became to fall out of my life and mind. My thinking, far from being clearer than a crystal, was tortuous. I would read the same passage over and over again, only to realize that I had no memory at all for what I had just read. Each book or poem I picked up was the same way, incomprehensible. Nothing made sense. Now let's go to the course of bipolar disorder. Episodes of mania and depression typically recur across the lifespan. Between episodes, most people with bipolar disorder are free of symptoms, but as many as one-third of people have some residual symptoms. A small percentage of people experience chronic, unremitting symptoms despite treatment. The classic form of the illness, which involves recurrent episodes of mania and depression, is called bipolar 1 disorder. Some people, however, never develop severe mania, but instead experience milder episodes of hypomania that alternate with depression. This form of the illness is called bipolar 2 disorder. When 4 or more episodes of illness occur within a 12-month period, a person is said to have rapid cycling bipolar disorder. Some people experience multiple episodes within a single week or even within a single day. Rapid cycling tends to develop later in the course of illness and is more common among women than among men. People with bipolar disorder can lead healthy and productive lives when the illness is effectively treated. Without treatment, however, the natural course of bipolar disorder tends to worsen. Over time, a person may suffer more frequent, more rapid cycling, and more severe manic and depressive episodes than those experienced when the illness first appeared. In most cases, however, proper treatment can help reduce the frequency and severity of episodes and can help people with bipolar disorder maintain good quality of life. Now let's go to treatment of bipolar disorder. Most people with bipolar disorder, even those with the most severe forms, can achieve substantial stabilization of their mood swings and related symptoms with proper treatment. Because bipolar disorder is a recurrent illness, long-term preventative treatment is strongly recommended and almost always indicated. A strategy that combines medication and psychosocial treatment is optimal for managing the disorder over time. Medications known as mood stabilizers are usually prescribed to help control bipolar disorder. Several different types of mood stabilizer are available. In general, people with bipolar disorder continue treatment with mood stabilizers for extended periods of time, years. Other medications are added when necessary, typically for shorter periods to treat episodes of mania or depression that break through despite the mood stabilizer. Medications for bipolar disorder include the following. Lithium, the first mood stabilizing medication approved by the US FDA for treatment of mania, is often very effective in controlling mania and preventing the recurrence of both manic and depressive episodes. Anticonvulsant medications such as valproate or carbamazepine also can have mood stabilizing effects and may be especially useful for difficult to treat bipolar episodes. Newer anticonvulsant medications, including lamotrigine, gabapentin, and topiramate, are being studied to determine how well they work in stabilizing mood cycles. Generally, children and adolescents with bipolar disorder are treated with lithium, but valproate and carbamazepine also are used. There is some evidence that valproate may lead to adverse hormone changes in teenage girls and polycystic ovary syndrome in women who began taking the medication before age 20. Therefore, young female patients taking valproate should be monitored carefully by a physician. Research has shown that people with bipolar disorder are at risk of switching into mania or hypomania, or of developing rapid cycling during treatment with antidepressant medication. Therefore, mood stabilizing medications generally are required, alone or in combination with antidepressants, to protect people with bipolar disorder from this switch. Lithium and valproate are the most commonly used mood stabilizing drugs today. As an addition to medication, psychosocial treatments, including certain forms of psychotherapy, are helpful in providing support, education, and guidance to people with bipolar disorder and their families. Studies have shown that psychosocial interventions can lead to increased mood stability, fewer hospitalizations, and improved functioning in several areas. A licensed psychologist, social worker, or counselor typically provides these therapies and often works together with a psychiatrist to monitor a patient's progress. The number, frequency, and type of sessions should be based on the treatment needs of each person. Psychosocial interventions commonly used for bipolar disorder are cognitive behavioral therapy, psychoeducation, family therapy, and a newer technique called interpersonal and social rhythm therapy. Cognitive behavioral therapy helps people with bipolar disorder to learn to change inappropriate or negative thought patterns and behaviors associated with the illness. Psychoeducation involves teaching people with bipolar disorder about the illness and its treatment and how to recognize signs of relapse so that early intervention can be sought before a full-blown illness episode occurs. Psychoeducation may also be helpful for family members. Family therapy uses strategies to reduce the level of distress within the family that may either contribute to or result from the ill person's symptoms. Interpersonal and social rhythm therapy helps people with bipolar disorder both to improve interpersonal relationships and to regularize their daily routines. Regular daily routines and sleep schedules may help protect against manic episodes. Now let's look into the history of bipolar disorder. I read to you Cappadocia, 2nd century AD, says, melancholia is without any doubt the beginning and even part of the disorder called mania. Alexander of Tralles said, mania is nothing else but melancholia in a more intense form. Jason Patensis says, most physicians associate mania and melancholia as one disorder. He distinguished mania and melancholia by degree and manifestation only. Dr. Thomas Willis, 17th century, In the melancholic, the spirits were somber and dim. They cast their shadows over the images of things and formed a kind of dark tide. In the manic, on the contrary, the spirits seethed in a perpetual ferment. They were carried by an irregular movement, constantly repeated, a movement that eroded and consumed, and even without fever, sent out its heat. Between mania and melancholia, the affinity is evident, not the affinity of symptoms linked in experience, but the affinity more powerful and so much more evident in the landscapes of the imagination that unites in the same fire both smoke and flame. Richard Mead in 1751, two kinds of madness. The one is attended with audaciousness and fury, the other with sadness and fear, and that they call mania, this melancholy. But these generally differ in degree only. For melancholy, very frequently changes sooner or later into maniacal madness, and when the fury is abated, the sadness generally returns heavier than before. Jean-Pierre Paulrat and Jules Baillarger in the mid-19th century formally posited that mania and depression could represent different manifestations of a single illness. Now let's talk about bipolar disorder in Chinese medicine. Bipolar disorder follows closely the symptoms of the ancient Chinese disease of Tian Kuang, which may be translated as dullness and raving or dullness and mania. Tian Kuang does not necessarily correspond exactly to bipolar disorder. Tian is not depression as we intend it in Western psychiatry. Tian could correspond to schizophrenia. Epilepsy was often confused with Tian of Tian Kuang in the past. Tian Kuang itself may correspond to schizophrenia. Pathology of Tian Kuang. In Tian Kuang, there is always a disharmony of yin and yang. In mania, there is an excess of yang, such as fire. In this condition, there is an excess of yang also in the sense that yang is rising to the top of the body. In dullness, there is, broadly speaking, an excess of yin in the form of phlegm and qi stagnation. Of course, that is not to say that there is no phlegm in mania, as there certainly is, but it is usually combined with fire. Central to the pathology of Tian Kuang is phlegm, and both the depressive and the manic phases are due to obstruction of the mind by phlegm. This is a major difference between the depressive phase of bipolar disorder or Tian Kuang, dullness, and depression. In depression, there are many patterns without phlegm. Moreover, the depressive and the manic phases of bipolar disorder, although so different from each other in their manifestations, are really two sides of the same coin. The constraint of qi-induced emotional stress usually leads to heat and fire. In manic depression, there is nearly always fire, which, together with phlegm, accounts for the rash behavior during the manic phase. Fire combines with phlegm and it harasses upwards to agitate the mind while the phlegm obstructs it. The fire harassing upwards derives primarily from the liver and heart. The chi stagnation caused by emotional stress in time leads to blood stasis. This is a feature of chronic cases of manic depression and one that complicates the conditions of phlegm and fire. The essential pathology in bipolar disorder is the excessive coming and going of the ethereal soul, even in its depressive phase. The ethereal soul gives the mind inspiration, creativity, ideas, plans, life dreams, and aspirations. This psychic energy is the result of the coming and going of the ethereal soul, and it is the psychic manifestation of the free flow of liver chi, and in particular, the physiological ascending of liver chi. There are two possible factors leading to this situation. If the mind is weak and fails in its restraint and control, the ethereal soul may be too restless. and its movement excessive, only bringing confusion and chaos to the mind, making the person restive, unsettled, and to some degree manic. On the other hand, the movement of the ethereal soul may in itself be excessive, not because the mind is failing to control it. The result is the same, that is, an excessive amount of ideas, life dreams, plans, and projects flowing out of the ethereal soul and making the person to some degree manic. So we have here an illustration of the two situations when the coming and going of the ethereal soul is excessive, either in itself on the left-hand side and or because the mind does not control it enough on the right-hand side. If the movement of the ethereal soul is excessive, contents breaking through from the ethereal soul cannot be integrated by the mind. The mind should integrate the ethereal soul so that images, symbols, and dreams coming from it can be assimilated. When the coming and going of the ethereal soul is excessive, there is a steady and excessive stream of ideas, inspiration, and plans flooding the mind. In serious cases, this can lead to mania. Whenever the coming and going of ethereal soul is excessive, there is the possibility of manic behavior. Thus, in mania, there is always an excessive movement of the ethereal soul. Now let's go to the symptoms of mild mania in normal individuals. Mental restlessness, agitation, hyperactivity, working and being active at night, spending a lot, having many projects simultaneously, none of which comes to fruition, mental confusion. It is interesting to note that people suffering from bipolar disorder are often artistic. Or to put it differently, among famous artists, there is a disproportionate incidence of bipolar disorder. This is due to the fact that the artistic inspiration derives from the ethereal soul. Therefore, the same psychic energy of the ethereal soul that makes someone artistic in pathological conditions may also make them mentally ill. During manic episodes, the bipolar patient is bristling with ideas. He or she is inspired, feelings intensify, sensations are keener, and he or she often writes poetry. Another symptom would be talking a lot, propensity to take risks, and they're often artistic. Etiology of Tian Kuang. Emotional stress is the main etiological factor of bipolar disorder. Anger, worry, excess, joy, and guilt may all be the initial cause of this disease. The initial qi stagnation resulting from emotional stress generates heat, which harasses the mind. The stagnation of qi in the triple burner leads to impairment of transformation of fluids and therefore to phlegm. This is also aggravated by the condensing action of heat on fluids. Anger, shock, and fear injure liver and kidneys. These become deficient and lose the nourishment of water, which causes Tian. Excess joy and anger injure heart yin. This leads to heart fire and Kuang. Pensiveness and worry injure heart and spleen. The heart loses its nourishment, the spleen cannot transform, and this leads to Tian. Worry and pensiveness injure heart and spleen. The spleen cannot transform and transport, and this gives rise to phlegm. As phlegm plays a central role in the pathology of bipolar disorder, irregular diet is an important contributing factor to its etiology. Excessive consumption of dairy foods, fatty foods, carbohydrates, and sugar leads to the formation of phlegm. Phlegm may also be formed when the person eats in an irregular and chaotic way, that is, eating late at night, eating in a hurry, eating while working. A constitutional tendency to mental emotional problems plays a role in the development of bipolar disorder. Both children and adolescents can develop bipolar disorder. It is more likely to affect the children of parents who have the illness. From the point of view of Chinese medicine, a tongue with a deep heart crack indicates a tendency to mental emotional problems. In Tian, there is often phlegm with qi stagnation and a deficiency of heart and spleen. In Kuang, there is often phlegm fire, agitating and obstructing the mind and eventually leading to yin deficiency. In chronic cases, the qi stagnation and the phlegm may also give rise to blood stasis. Pathology of Tian Kuang. The pathology of bipolar disorder is complex, especially in chronic conditions. In the beginning stages, there is qi stagnation, fire, and phlegm, while in later stages, there is also a deficiency of qi, blood, or yin. The manic stage is characterized by more fullness, while the depressive stage is characterized by a mixture of full and empty conditions. 4 words could summarize the pathology of bipolar disorder: qi for stagnation, fire, phlegm, and stasis of blood. Central to the pathology of bipolar disorder and Tian Kuang is phlegm. Bipolar disorder is a serious mental illness characterized by loss of insight. In Chinese terms, this is due to obstruction of the mind's orifices. The mind's orifices can be obstructed by phlegm or by severe blood stasis. In bipolar disorder and Tian Kuang, the mind's orifices are obstructed principally by phlegm, although in later stages, blood stasis may also contribute to the obstruction. Obstruction of the mind by phlegm accounts for both the manic and the depressive phases of bipolar disorder. Please note that phlegm does not derive only from a spleen deficiency. Qi stagnation may give rise to phlegm by obstructing the free flow of qi in the 3 burners. Fire can also give rise to phlegm by condensing the body fluids. Blood stasis, which itself derives from qi stagnation, aggravates phlegm. In bipolar disorder, there is usually also fire, which agitates the mind and ethereal soul and stokes up the manic behavior of the person. In chronic cases, fire induces yin and the resulting empty heat further agitates the mind. Furthermore, the qi stagnation that is usually present in the beginning stages of bipolar disorder may also give rise to blood stasis. This further clouds the mind's orifices. The pathology of the manic phase of bipolar disorder is characterized by qi stagnation, phlegm that clouds the mind's orifices, fire which harasses the mind and causes mania, blood stasis which obstructs the mind's orifices further, and yin deficiency. The main organs involved are heart, liver, and spleen. Another essential characteristic of the pathology of bipolar disorder in its manic phase is the excessive coming and going of the ethereal soul, the hun, resulting in the flooding of the mind by ideas, projects, plans, inspiration in a chaotic way that leads to mania. The mind needs to control and integrate the psychic material deriving from the ethereal soul. The mind can deal with only one thing at a time. Flooding of the mind by the psychic material deriving from the ethereal soul results in total immersion of the mind within the ethereal soul and therefore mental illness, as in bipolar disorder. The pathology of the depressive phase is characterized by a mixture of full and empty conditions. In the beginning stages, there is qi stagnation and phlegm, which obstructs the mind's orifices. In chronic cases, there is a deficiency of the heart and spleen. The main organs involved in the pathology of bipolar disorder are therefore the heart, liver, lungs, and spleen. Now let's talk about the treatment principles for Tian Kuang. The condition causing dullness, the Tian, is yin and empty in character, and that the main pathogenic factors are phlegm and qi stagnation. The treatment principle is therefore to resolve phlegm, move qi, eliminate stagnation, settle the heart, calm the mind, tonify qi and nourish blood. The condition leading to mania, or Kuang, is yang and full in character. The main pathogenic factors are fire, phlegm, and blood stasis. The treatment principle is therefore to drain fire, resolve phlegm, invigorate blood, and eliminate stasis. In later stages, nourish yin and clear empty heat. The treatment principle of dullness in the acute stage must address the manifestation, resolve phlegm, and open the mind's orifices. In between attacks, one must tonify the heart and the spleen, resolve phlegm, move qi, and eliminate stagnation, treating the root. The treatment principle of mania in the acute stage must address the manifestation by resolving phlegm and opening the mind's orifices. In between attacks, one must regulate yin and yang, nourish yin, and clear empty heat, treating the root. So to summarize, for depression or the Dian, during the acute stage, we resolve phlegm, open the mind's orifices. And for mania, we resolve phlegm and open the mind's orifices as well. In between attacks, where we treat the root, for depression, we tonify heart and spleen, resolve phlegm, and move the qi. For mania, we regulate yin and yang, nourish yin or blood, and clear empty heat. Differentiation between Dian and Kuang. Pathology. Dian is caused by qi stagnation and phlegm, while Kuang is caused by phlegm fire harassing the heart. Mood symptoms: unhappy and dull thinking for Dian, agitation, mania, anger, anxiety for Kuang. Speech symptoms: the speech would be incoherent in Dian, silent, and stumbling. And for Kuang, there will be incessant talking, incoherent speech, shouting, abuse, and cursing. Movement symptoms for Dian: singing, crying, likes to be alone, sadness, erratic behavior. While we have mania, anger, ascends to high places and sings, casts off clothes, hitting people, taking risks in Kuang. Special points for Dian: stillness and depression, and for Kuang, we have a lot of movement and frequent changes. Dian is yin, Kuang is yang. Acupuncture treatment for bipolar disorder. Points that open the mind's orifices are as follows. We start with lung 3. This is called Heavenly Palace. This is a window of the sky point. We use this as first aid for carbon monoxide poisoning. We consider lung 3 for mental confusion, severe depression, claustrophobia, agoraphobia, or forgetfulness. As a window, it can lift and revitalize the spirit of a person cut off or imprisoned within themselves, often as a result of the reaction to chronic grief or sadness. We commonly use lung 3 with Li17 or Li18. Large intestine 5 or Yang stream is a fire point, Qing River point. This often neglected point can have a remarkable effect on certain mental disorders. It is said to be helpful for people who see ghosts and spirits when it is commonly sedated. Li5 is also for mad people who want to throw off their clothes, often used together with Li4 for their purifying and enlivening effects. We consider Li5 for tinnitus, deafness, skin disorders, incoherent speech, stuttering, pain, or arthritis of the hand, thumb, or wrist. Can be used to warm a cold or inert metal causative factor. Large intestine 7 is a she cleft or accumulation point. This can be used to warm a metal causative factor who is physically or emotionally cold, inert, withdrawn, or despairing, and it can take a lot of moxa, up to 30. It is said to treat madness, the seeing of ghosts, mania, and hysteria. It nourishes, strengthens, and invigorates the meridian. Consider Li7 for acute conditions associated with the large intestine. Stomach 25 is called a heavenly pivot. This is the front mu alarm point for large intestine. This is the point to release the internal dragons. This important point is at the center of one's being. Above is heaven, below is earth. It's a central pivot of our heavenly and earthly chi. It is also the name of the central star in the northern Big Dipper, also known as the plow. The other six stars rotate around it. Great for earthing a person who is experiencing a lot of ups and downs, mood swings, mania, anxiety, or mental instability. Stomach 25 is said to be helpful for women who are preoccupied with gynecological problems such as conception, infertility, or are experiencing menstrual disorders. We often pair stomach 25 with spleen 15 in order to enhance its stabilizing action. Its name is recorded in a manuscript from the 1st century BCE. Stomach 40, abundant splendor. This is a luo connecting point or junction point. This is also called the quiet word point. This wonderful nurturing point connects and enhances the stomach, who rots and ripens, to the one that transports and transforms, thus bringing balance and harmony to the earth element. It is one of the main points in TCM to resolve and clear damp and phlegm from the system. And thus, stomach 40 can help with mental fogginess and confusion, lethargy, poor memory, worry, or obsessive thinking. Stomach 42, rushing yang. This is a source point, exit point, perfect calm point. This frequently used point can calm the system if there is worry, anxiety, mania, overthinking, or instability troubling the patient. It can be combined with Sanjiao 4 for general harmonization of the system, or with Li4 to augment this calming effect. Conversely, stomach 42 can be used to invigorate the whole meridian. Stomach 45, hard bargain. This is a metal point, sedation point, a Jingwell point. This is also called a cruel payment point. This is a good first aid for indigestion and hangover. Being the sedation point, stomach 45 can be used to calm the mind and spirit, effective for insomnia and agitation, problems of the mouth, particularly deviation of the mouth, or clenched jaws. Small intestine 16, heavenly window. This is a window of the sky point. It calms the spirit and brings a new perspective to a person who has lost hope and vision, or who is unable to resolve their present difficulties because they cannot separate pure from impure. Helps with mental concentration. We use SI16 for neck problems or where there is sluggishness or lethargy present. Next is bladder 10, heavenly pillar. This is a window of the sky point, the point of sea of chi. This window and sea of chi point can be as powerful as the kidney chest points, from kidney 22 to 27. Bladder 10 treats the spirit of the bladder. It clears the brain, stimulates memory and concentration. It gives a new perspective on a person's life if living under a cloud of fear. Heavenly pillar, pillar in the name may refer to the trapezius muscles which support the head as it treats disorders of the neck. It is named after a star, thus indicating its spiritual quality. Pericardium 5, the intermediary. This is a metal point, a Jing River point, crossing point of heart, pericardium, lung. This is a ghost point. As the intermediary, it listens to all sides and brings harmony. This point mediates between the heart, pericardium, and lung. PC5 is a very important point, assisting the heart in its communication with the other officials, the other organs. It can ease many stomach disorders. Fire is the mother of earth. For example, inability to digest food, abdominal cramps, or nervous vomiting. Beneficial for cardiac pains, irregular periods, or vaginal discharge. We consider pericardium 5 if the patient feels as though they are possessed by the devil. This is one of the 13 classic points for a degree of possession. For a sensation of heat in the palms of the hands, PC5 is helpful for palpitations, insomnia, hysteria, or manic depression. Gallbladder 13, root spirit. This is the crossing point of gallbladder and the yang wei mai, or yang linking vessel. This important point has a similar name, Ben Shen, to Chapter 8 of the Ling Shu, which focuses on supporting the root of a patient, their spirit. Gallbladder 13 is used for disorders of the mind and spirit. It settles epilepsy, madness, jealousy, anger, obsessive thinking, and suspicion. GB13 counts the spirit if it's been uprooted or unearthed. It can strengthen a person's ability to be more assertive, present, and decisive. Consider using GB13 with GB15, 16, 38, Heart 5, RAN 4, or 224. Gallbladder 17, upright living. This is the crossing point of gallbladder and yang wei mai. Gallbladder is known as the upright and correct official, and this point can help strengthen these attributes within a person. GB17 can bring serenity to the spirit, particularly if fear and loneliness predominate. It is said to enhance Wood's virtue of benevolence and human kindness, located horizontally with the apex of the head. GB18, receiving spirit. This is the crossing point of gallbladder and yang wei mai. The name refers to the Ling spirit. It can profoundly enhance our sensitivity and awareness, particularly if we are stuck in obsessional thought patterns. GB18 is said to connect to the universal spirit and is located at a place called the cover of the celestial spirit. Consider GB18 for nasal congestion. It is also a point to consider if there are signs of dementia. Do16, Wind Palace. This is a window of the sky point, point of the Sea of Marrow, ghost point, crossing point of Tu Mai and Yang Wei Mai. Do16 is effective in treating the mind, in treating the patient at the spirit level. It can clear the head and bring perspective to their life and aid the integration of body, mind, and spirit. It helps the patient to hear and see with enhanced clarity. As a Sea of Marrow point, in combination with Do15, 19, and 20, Do16 can nourish the brain and the senses. This is a window of the sky point. It is suggested that the practitioner consider treating window points on the causative factor first before using this point to gauge its response. Do19, posterior summit. This is the point of Sea of Marrow, commonly used together with Do20 when the pulse picture is chaotic and the patient is severely agitated and disturbed. The treatment in this case is usually sedation. Do19 helps calm and settle the patient and restores order amongst all the organs. For anxiety, when the Shen or spirit is disturbed, consider combining Do19 with REN15. Do20, 100 meetings. This is the point of Sea of Marrow, the crossing point of all yang meridians, the point to release the external dragons, crossing of the Dumai with the deep pathway of the liver. The head is the meeting place of the 100 spirits. This is a comment from the Taoist storehouse text. Do20 is another powerful spirit point which sits on top of the head, the meeting place of the 100 spirits. It calls upon our innate wisdom and knowledge and can bring everything together if a patient is fragmented, disconnected, chaotic, or severely agitated. In these cases, it is commonly sedated in conjunction with Do19 so that the patient may be returned to a calm and serene place. It connects to the deep pathway of the liver and thus can be effective in cases where anger, frustration, depression, or lack of vision predominate. Do20 strengthens the ascending function of the spleen and can be considered for prolapse of the anus, vagina, or uterus. As the crossing point of all the yang meridians, situated as it is in a prime position to receive the heavenly influxes on a meridian that regulates the yang, this is a point that strongly influences this aspect of a person. Do20 clears the senses and nourishes the brain. When combined with kidney 1, which is the point closest to the earth, a patient can be helped to reconnect with their authentic self and their rightful position between heaven and earth. Do26, the middle of man. This is the crossing point of Dumai, Renmai, Li, and stomach. Ghost point. Another powerful point that goes to the very center of our being, as it sits between the nose, which receives the heavenly chi, and the mouth, which receives the potential for earthly chi, with humankind in the middle. Along with Du 27 and 28, it helps regulate the yin-yang balance within, especially if there is severe oscillation of emotion or mood, such as bipolar disorder or mania. Consider 226 when the patient is not whole within their spirit or when a degree of possession is suspected, used as a resuscitation point for loss of consciousness. And we use all the Jingwell points. Jingwell points are a group of acupuncture points located at the tips of the fingers and toes where there is little flesh. The chi at these points is considered to be shallow and narrow, yet dynamic, pouring forth like a spring or well. As the most superficial and sensitive points on these channels, the Jingwell points are frequently used for treating acute conditions such as headaches, fever, or pain. The volatility of the chi at these points is further emphasized by the fact that these locations at the extremities of the hands and feet are where yin and yang channels converge, where the chi changes direction and polarity. Yin transforms into yang and vice versa, and where the human body forms an interface with the exterior, that is heaven, the yang, and earth, the yin, or our external environment. Sun Si Miao listed 13 points for the treatment of Dian Kuang. In the following list, the first name that you will see is the most common one, and the one next to it is the alternative name. As can be seen, all the alternative names contain the word kui, that is coast. This is due to the fact that some kind of mental illnesses were considered to be due to the invasion of ghosts. So these are the instructions by Sun Si Miao. Ren 1 is used in men with moxa cones, and human in the anterior fold of the vagina is used in women with a moxa stick. Hai Chuan is a point in the veins under the tongue. The points were used for insanity from invasion of evil spirits. Use points bilaterally, but start on the left for men and the right for women, and withdraw in reverse order. So modern use of these points are for anxiety, uncontrolled weeping, fear, fright, disorientation, delirium, seizures, depression, hysteria, and mania. The pericardium channel in manic depression. In the acupuncture treatment of manic depression, it is important to place the emphasis on the pericardium channel to open the mind's orifices. The medical records of the Guide to Clinical Practice states, depression is due to worry, the diseases in the spleen, heart, and pericardium channels. The main points from the pericardium channel to open the mind's orifices are P7, P8, and P5. Pericardium 7 is selected in case of severe mania to calm the mind and settle the ethereal soul. This is a source point. It is also called the Great Mound, the Earth Point, Sedation Point, Shoestream Point. It is a sexual calm point. PC7 is one of the 9 needles for returning yang. Consider when the patient is suffering from insecurity, vulnerability, sadness, rejection, or lack of joy, particularly when associated with relationship difficulties. As the Earth Point, it calms, stabilizes, and strengthens the meridian. PC7 also affects the heart in this way, protecting and steadying it, especially in times of emotional turmoil. Consider pericardium 7 when there is hysterical laughter or crying, or where mania or nervous panic is being exhibited. This point can be effective in cases of carpal tunnel syndrome or heat in the palm of the hand. Pericardium 8 is selected if there is fire. Pericardium 8 is palace of weariness. It's a fire point, horary point, seasonal horary point, summer, exit point, yin spring point, and a ghost point. Pericardium 8 brushes the ash off the fire meridian, allowing joy, love, vitality, and vigor to emerge once more to a patient weary of life. One of the most powerful points on the body, bringing elation, joy, and hope back to a person, especially if depressed or when very low in spirit. If the fire is deficient, the patient cannot share warmth or affection. This may result in their becoming cold, rigid, or miserable. It causes the energy of the heart to leap up. PC8 is helpful where a patient is experiencing excessive sexual fantasies or conversely, impotence. PC8 is local point for pain and stiffness in the hand. There are 3 ghost points on this meridian, which further illustrates its role as protector of the heart, particularly in cases such as out of control behavior, mania, or some degree of possession. Consider the use of moxa here in PC8, but take care not to overheat. Pericardium 5, the intermediary. It resolves phlegm from the mind. It is a metal point, Jing River point, crossing point of the heart, pericardium, lung. It is a ghost point. As the intermediary, Pericardium 5 listens to all sides and brings harmony. This point mediates between the heart, pericardium, and lung. A very important point, assisting the heart in its communication with the other organs. It can ease many stomach disorders. Fire is the mother of earth. For example, inability to digest food, abdominal cramps, or nervous vomiting, and beneficial for cardiac pains, irregular periods, or vaginal discharge. Consider pericardium 5 if the patient feels as though they are possessed by the devil. This is one of the 13 classic points for a degree of possession, for a sensation of heat in the palms of the hands. This is helpful for palpitations, insomnia, hysteria, or manic depression. Identification of patterns and treatment for Dian. Qi stagnation and phlegm. Clinical manifestations, depression, apathy, dull thinking, incoherent speech, muttering to oneself, inappropriate laughter, not remembering to eat, emotional dullness, alternation of anger, and laughing without reason. Tongue is swollen with sticky coating, pulse wiry and slippery. Treatment principle: remove the qi, eliminate stagnation, resolve phlegm, open the mind's orifices. Points: pericardium 6, liver 3, triple burner 6, PC5, stomach 40, REN 12, REN 9, spleen 6, 220. All are needled with reducing or even method. P6, liver 3, triple burner 6 will move the qi and relieve depression. Pericardium 5 resolves phlegm from the heart and mind and opens mind's orifices. Stomach 40, REN 12, REN 9, spleen 6 resolve the phlegm. 220 lifts mood and opens mind's orifices. The next pattern is heart and spleen deficiency with phlegm. Clinical manifestations: depression, excessive dreaming, insomnia, mental confusion, easily startled, bewilderment, sadness, crying, shutting windows, muttering to oneself, visual or auditory hallucinations, palpitations, dull pale complexion, slow movement, dislike to speak, loose stools, tiredness, weak limbs, poor appetite. The tongue would look pale and swollen with a sticky coating. Pulse will be saggy. Treatment principle: strengthen the spleen, nourish heart, benefit the qi, calm the mind, resolve phlegm, open the mind's orifices. Points: heart 7, heart 5, PC5, stomach 36, REN 12, bladder 20, DO 24, DO 20, stomach 40, REN 9, and spleen 6. Heart 7, heart 5, stomach 36, REN 12, and bladder 20 are needled with reinforcing method all the others with even method. Heart 7 and Heart 5 will tonify the heart. PC5 will open the mind's orifices and resolve phlegm from the mind. Stomach 36, REN 12, bladder 20, using reinforcing method, will tonify the spleen. Do 24 and do 20 will lift the mood and open the mind's orifices. Stomach 40, REN 9, and spleen 6 will resolve the phlegm. Next pattern is Qi deficiency with phlegm. Clinical manifestations. This is a chronic condition. Emotional dullness, reluctance to move or speak, staring eyes, inappropriate laughter, muttering to oneself, incoherent thinking, visual and auditory hallucinations, self-reproach, feeling of guilt, mental dullness, loose stools, pale complexion, tiredness, shortness of breath, no appetite. Tongue is pale, pulse soggy. Treatment principle, tonify the lung, stomach, and spleen qi. Resolve phlegm, open the mind's orifices. Points, lung 9, bladder 13, REN 12, bladder 20, bladder 21, stomach 36, REN 9, spleen 6, stomach 40, PC5, PC6, do 20, and do 26. Lung 9, bladder 13, REN 12, bladder 20, bladder 21, stomach 36 are needled with reinforcing method. All the others with even method. Lung 9 and bladder 13 will tonify lung qi. REN 12, bladder 12, 20, 21, stomach 36 will tonify stomach and spleen qi. REN 9, spleen 6, stomach 40 will resolve phlegm. PC5 and 6 will open the mind's orifices. Do 20 and 26 will open the mind's orifices and clear the brain. Next pattern is knotted heat in the heart channel. Clinical manifestations, depression with sudden onset, flustered feeling in the heart region, laughing without reason, insomnia, feeling of heat in the nose and eyes, thirst, mouth ulcers. The tongue would be red with redder tip and yellow coating. Pulse will be overflowing and rapid. Treatment principle, drain heart fire, open the mind's orifices, calm the mind. Points, heart 8, heart 7, do 24, REN 15, bladder 44, pericardium 8, and pericardium 5. All are needled with reducing or even method. Heart 8 will drain the heart fire. Heart 7, do 24, REN 15, bladder 44 will clear heart heat and calm the mind. Pericardium 8 will drain heart fire and open the mind's orifices. Pericardium 5 will resolve phlegm from the mind. Next pattern is phlegm obstructing the heart's orifices. Clinical manifestations, depression, mental dullness, backwardness, emotional dullness, muttering to oneself, incoherent speech, staring eyes, absence of blinking. The tongue is swollen with sticky coating, pulse is slippery. Treatment principle, resolve phlegm, open the mind's orifices. Points, PC5, do 20, do 24, stomach 40, spleen 6, REN 9. All are needled with reducing or even method. PC5, do 20, do 24 will open the mind's orifices. Stomach 40, spleen 6, and REN 9 will resolve the phlegm. Identification of patterns and treatment. Kuang. The first pattern is phlegm fire, harassing upwards. Clinical manifestations, manic behavior with sudden onset, emotional upsets, shouting, scolding, or hitting people, exceptional physical strength, not eating or sleeping, agitation, an angry look in the eyes, shouting abuse, desire to climb to high places, irritability, inability to rest, breaking things, rush, impulsive behavior, rash movements, constipation, headache, insomnia, red face and eyes, anger. Tongue is red with thick, sticky yellow coating, with a stomach heart crack with rough, sticky, dry yellow coating inside it. Pulse is rapid, wiry, overflowing, slippery. Treatment principle: calm the heart, resolve phlegm, drain liver fire, drain heart fire, open the mind's orifices. Points: PC7, 5, liver 2, heart 8, PC8, do 19, GB 17, 18, stomach 40, REN 12, REN 9, spleen 6. All are needled with reducing or even method. PC7 and 5 will open the mind's orifices. Liver 2, heart 8 will drain liver and heart fire, respectively. PC8 will drain heart fire and open the mind's orifices. Do 19, GB 17, and 18 will calm the mind and open the mind's orifices. Stomach 40, REN 12, REN 9, spleen 6 will resolve the phlegm. The next pattern is fire in bright yang. Clinical manifestations: manic behavior, raving, walking, shouting, abusing people, climbing to high places, singing, discarding clothes, unusual physical strength, foul breath, red face, constipation. Tongue, red with dark yellow or black, dry coating. Pulse, deep and wiry. Treatment principle: drain the stomach fire by moving downwards, calm the mind, open the mind's orifices, resolve phlegm. Points: stomach 44, LI 11, stomach 40, PC 8, heart 8, stomach 25, spleen 15, PC 5. All are needled with reducing or even method. Stomach 44 and LI 11 will drain stomach fire. Stomach 40 will help to drain stomach fire. PC8, heart 8, drain heart fire and calm the mind. Stomach 25 stabilizes ethereal soul and corporeal soul. Spleen 15 moves downwards and promotes bowel movement. PC5 will resolve phlegm from the mind. Next pattern is gallbladder and liver fire. Clinical manifestations: manic behavior, irritability, propensity to outbursts of anger, red face and eyes, bitter taste, laughing inappropriately, shouting, hypochondrial and chest pain, palpitations. Tongue is red with dark yellow coating, pulse, rapid, wiry, slippery. Treatment principle: drain liver fire, resolve phlegm, calm the mind. Points: liver 2, GB 44, LI 11, stomach 40, spleen 6, REN 9, heart 7, PC 5. All are needled with reducing or even method. Liver 2 and gallbladder 44 will drain liver and gallbladder fire. LI 11 will clear heat and cool blood in general. Stomach 40, spleen 6, REN 9 will resolve phlegm. Heart 7 will calm the mind. PC 5 will resolve phlegm from the mind. Up next is fire enduring yin with phlegm. Clinical manifestations: chronic Kuang, talking a lot, easily startled, mental restlessness, thin body, that means there is loss of weight, red face, male or flush, feeling of heat in the evening. Tongue is red, swollen, without coating. Pulse is fine, rapid. Treatment principle: nourish the yin, clear empty heat, calm the mind, resolve phlegm, open the mind's orifices. Points: heart 7 and 6, PC 7, kidney 3, REN 4, spleen 6, stomach 40, REN 12, REN 9, do 24, do 19, and PC 5. Kidney 3, REN 4, and spleen 6 are needled with reinforcing method, all the others with even method. Heart 7, 6, and PC7 will calm the mind and open the mind's orifices. Kidney 3, Ren 4, spleen 6 will nourish yin. Stomach 40, Ren 12, and 9 will resolve phlegm. Do 24, 19 will calm the mind and open mind's orifices. And PC5 will resolve phlegm from the mind. Next, we have chi stagnation, blood stasis, and phlegm. Clinical manifestations, chronic Kuang, talking a lot, easily startled, mental restlessness, abdominal pain, dark complexion, insomnia, agitation at night. Tongue, reddish purple, swollen. Pulse, wiry, slippery. Treatment principle, move the chi, invigorate blood, eliminate stasis, resolve phlegm, calm the mind, open the mind's orifices. Points, pericardium 6, heart 7, liver 3, spleen 10, bladder 17, stomach 40, Ren 12, Ren 9, do 24, do 19, GB 17, GB 18, and pericardium 5. All are needled with reducing or even method. PC6 and heart 7 will calm the mind and invigorate blood. Liver 3, spleen 10, bladder 17 will invigorate blood and eliminate stasis. Stomach 40, Ren 12, and 9 will resolve phlegm. Do 24 and 19 will calm the mind and open the mind's orifices. Gallbladder 17 and 18 will open the mind's orifices, and pericardium 5 will resolve phlegm from the mind. And finally, we have yin deficiency with empty heat. Clinical manifestations, chronic manic behavior, listlessness, incessant talking, easily startled, mental restlessness, insomnia. Tongue is red without coating. Pulse fine, rapid. Treatment principle, nourish yin, clear empty heat, calm the mind. Points, kidney 3, liver 8, spleen 6, Ren 4, heart 7, Ren 15, heart 6, PC7, stomach 40, Ren 9, PC5. Kidney 3, liver 8, spleen 6, and Ren 4 are needled with reinforcing method, all the others with even method. Kidney 3, liver 8, spleen 6, Ren 4 will nourish liver and kidney yin. Heart 7, Ren 15, heart 6, PC7 will calm the mind and clear empty heat. Stomach 40 and Ren 9 will resolve phlegm, and pericardium 5 will resolve phlegm from the mind. Thank you very much for your attention.